Hi, I'm Elizabeth Hyatt. I'm going to do the video presentation for the discussion this week on cognitive behavior therapy, or CBT. This is just one of the many types of therapy that we can use in practice. CBT is a purposeful attempt to preserve the demonstrated efficiencies of behavior modification and to incorporate the cognitive activities of the client in the efforts to produce therapeutic change. CBT was originally developed out of a concern that something was missing in behavior therapy, which makes sense. CBT has a client look at the ways, what they think, what their feelings are, what they think about those feelings, and their beliefs about those feelings, and then it has them turn around and look at, are those beliefs true, or is there evidence there to back it up that it's not true? And then it also has them look at what evidence shows is true instead of the way that they're thinking and processing things. So it integrates a focus on cognitions and assumes that changes in thought process will lead to changes in behavior. And it concentrates on the importance of changing beliefs, perceptions, and thinking patterns to produce positive affirmations and behavioral changes, of course. So the purpose of CBT is to teach people to identify, evaluate, and modify their own dysfunctional thoughts and beliefs. So let's get into some of the common elements of CBT. There's a careful assessment that is very important in CBT, and for the therapist to appreciate a more medical model approach to helping. Conceptualization is constructed, the client or the problem is defined and diagnosed, and a treatment plan is developed. The therapists that use CBT are typically very sensitive to the fact that their clients' situations are constantly revolving and changing, and that means that they will need to adapt the methods that they use in therapy. They can't just have a textbook way of doing this. This is very client-oriented and very client-focused. So it is necessary that therapists change their methods and the way they approach things throughout this therapeutic process, simply because the client's needs may change, or the problems surrounding their needs will adapt and change over time, and that creates the need for change in the therapeutic process as well. CBT is a goal-oriented, problem-focused, present-focused, and short-term. This isn't something that clients go into for years on end. This is something that they go into for, maybe a few months. The thought process behind it is, once we as therapists teach clients to really look at their beliefs and their thoughts and the truth behind those beliefs and thoughts, and emotions, that once we teach them to do that, maybe with one or two problems that they're facing, that they will then be able to take what they've learned in CBT and apply it to everyday, problems or other problems that come up in the future. Which is why this turns into more of a short-term therapy model instead of a long-term solution. Or a long-term therapeutic process, I should say. CBT is psychoeducational. Clients can utilize what they learn in therapy in their everyday lives and are taught how to be their own therapist. So, like I said before, once they are taught the necessary tools that they need to work through problems and to really look at those problems in a real life situation and what the truth behind those thoughts and feelings and emotions are, then they are able to use that in the future with other problems. Clients learn how to identify, evaluate, and modify their thoughts and behaviors to feel and behave in healthier ways. That's a really important part of CBT, is teaching clients to deal with problems in a healthy way and have positive coping skills. That's a really big goal of CBT. Task assignments, clients follow-up, and client and therapist feedback are important in ensuring the success of this approach. And homework is an essential part of CBT. Sometimes I know VA therapists that practice CBT will send clients home with homework sheets, and it has a like maybe 3 or 4 columns, and it'll say what's your thought, or what's the event or the feeling that you're having. How does this make you feel? What's your beliefs about those feelings and yourself, and then what's the evidence behind it to show that those aren't true, and then what are your true, like what does that evidence point to as the truth. This is something that clients take home. They work on it between sessions, and then when you come back to the next session, the therapist will go over that homework sheet with the client, and make sure they've really looked at the deeper meaning behind those thoughts and feelings, and maybe what the truth behind those are instead of what their perception of the truth is. So I think it's a really good way for people to learn how to process emotions, how to process feelings, and how to really figure out what the truth behind it is, and in turn that helps them change their thought pattern, which will help them change their beliefs about themselves or about the situation, those kinds of things. The other thing with so cognitive behavioral therapy is a more purposeful attempt to preserve the demonstrated efficiencies of behavior modification within a less doctrinaire context, and to incorporate cognitive activities of the client in an effort to produce therapeutic change. So that's basically what we just talked about. CBT does have a more complex view of human nature and pays more attention to how one's thoughts influence and affect one's behaviors and feelings. So again, kind of what we've been talking about, but more in a direct definition. There are 6 basic tenets of CBT. We won't go over all of them, but just some of the basics are most human learning is cognitively mediated. Thoughts, feelings, and behaviors are causally interrelated. Attitudes, expectancies, attributions, and other cognitive activities are central to producing, predicting, and understanding psychopathological behavior and the effects of therapeutic interventions. So I think this one's really important, because if a client comes in with a bad attitude or unrealistic expectations of the therapy process, then that's going to turn it into like they're not going to get what they think they're going to get out of therapy. So that's something that's really important to really look at when they first come in. I think is that, I know for me, I always ask, like, okay, what's your expectations of this session? What's your expectations of the overall therapy? And then we kind of look, I sit with my clients, I kind of look at that and say, okay, well, this expectation may not be a realistic one. This may be something that we really can't accomplish here, but let's look at what we can accomplish, and let's try to pull something from that expectation that we can incorporate into therapy and make that an achievable goal for them. So the cognitive process can be cast into testable formulations that are easily integrated with behavioral paradigms, and it is possible and desirable to combine cognitive treatment strategies with inactive techniques and behavioral contingency management. So that's something else that we talk about throughout therapy, with, at least I do with my clients, is that we have these goals, and then we, achieve those goals in therapy, but then how can we get the long-term management of those goals in the outside world, after therapy's over with, or even the same day, like you leave my office and you've learned 2 things in therapy. How can you take those 2 things that you learned today and incorporate it into the outside world? And I think CBT does a really good job of teaching that to clients and really working with them to be able to use what they learn in the outside world. And so the other thing, that CBT has 3 separate approaches, or there's 3 categories of CBT approaches: cognitive restructuring, coping skill therapies, and problem-solving therapies. I feel like in CBT in general, we tend to hit all 3 of those. Cognitive restructuring is changing the way people see themselves or think about their thoughts and their beliefs and their feelings. Coping skills, we obviously, incorporate positive coping skills into every therapy session. And then problem solving therapy is also incorporated into cognitive behavior therapy, because cognitive behavior therapy is not going to work if there's not a problem, or, an event that's happened that has now led to this negative thinking process. So problem solving just reiterates the positive thinking and the positive outlook on things. And it's that evidence-based, okay, I feel really sad because of, whatever. And then you, your belief behind feeling sad is, oh, it was my fault that that happened. Well, then when you really look at the evidence of it, it's probably not your fault that that happened. Your feelings are valid. Obviously, you're sad because, this happened, but it's not your fault that it happened. So we really work with clients to figure out how they can look at the evidence behind the fact that wasn't their fault. And then that gives them that positive outlook, and that gives them the problem-solving skills they need to really sit down and look at what is real, what's the truth, and what just their feeling behind it is. So digging into the therapeutic process and the relationship, the therapist in CBT is active and directive in conducting therapy with clients. However, CBT is a very client-focused process, and this is something that they can, the therapist is active in the session. However, it's really dependent upon how much work the client wants to put into it, and how much, the client will take what they learn in therapy and use it in their everyday life. So the client progress is continually assessed throughout the process of CBT, and therapeutic methods are adjusted in a flexible and sensitive way. So this goes back to the beginning when we were talking about the client's problems or thought process may change throughout therapy, and then the therapist has to adapt to that. I think that's important because problems tend to be fluid. They don't tend to be just one-sided or, one solid thing throughout. Life is always changing, so that means our clients' problems are always changing. The goal is just to make them be able to really use CBT in their everyday life without having a therapist there to direct them on how to do so. CBT emphasizes the importance of specific cognitive and behavioral interventions that go beyond the therapeutic effects of a positive therapeutic relationship. But that's not to say that a warm and collaborative therapeutic relationship isn't helpful, because it is. You always need that warm and therapeutic, warm and collaborative therapeutic relationship in any type of therapy that you do. However, in CBT, it's more client-focused and more client-based, and they kind of guide the way that they want the therapy to go, and then the therapist just kind of has to adapt to those changes, if any, but more times than not, there's going to be some changes throughout the CBT process. Some of the strengths of CBT is it's a comprehensive and versatile approach to therapy that has been used with diverse populations to address a wide range of psychological disorders and clinical problems in a variety of practice settings. So CBT can be used for depression, PTSD, anxiety, bipolar, there's a wide range of psychological disorders that CBT has been proven to work on. And again, it's not something that is focused on one culture or one race or anything like that. It's very accepting to any culture, to any race, to any psychological disorder that may be going on or clinical problems that may be going on. So CBT is an all-around really great therapy to use in any setting. It does focus on specific therapy goals set by the client in collaboration with the therapist, with regular monitoring of client process and therapy. Having that regular assessment going on keeps the client accountable for what they're doing, and having that homework for the client to do between sessions also keeps them accountable for how they're doing in therapy. Like I said, we weren't going to go over all the strengths, but that was just a couple that really stand out to me. Some of the weaknesses in CBT, it tends to focus on the treatment of clients presenting problems or symptoms and may not pay sufficient attention to the whole person and the client's total life context. This is a downfall in CBT because it's not something that you go in there and say, oh, I've had death, trauma, sexual assault, and domestic violence. I need to focus on all those things. It's typically, at least in my experience at the VA, you choose the one issue that's the most traumatic, or the one that's the most bothersome to you, and you learn to work through that. The thought process behind that is once you learn to work through that, then you can work through the other problems that you may be facing, or the other traumas that you faced. And obviously that's more post-traumatic stress related, but that's my experience with it, at the VA. And the downfall to that is the client doesn't get to sit in therapy and work on every, traumatic experience or every thought, feeling, emotion that they're having. But the thought behind it is, or the evidence behind it is that if you learn to work on the biggest issue, or the biggest, the most traumatic problem that you faced, and you learn to use CBT in that aspect, then you'll be able to then use CBT in the other areas that you're struggling in. The other downfall to CBT is the emphasis on teaching specific skills to the client assumes that the best way for clients to learn and change in therapeutic ways is to be directly instructed. Sometimes the client doesn't need to be directly instructed. You need to look at it like this, this, and this. Sometimes it's better to just have a conversation with your client, see where they're at, and then maybe just bring up ideas. It's, is it really that, or do you think it could be this? Which gets the client thinking about, maybe it could be something else. So sometimes with it being so directly instructed and so homework focused and that kind of thing, it is, I don't want to say detrimental. It's not as helpful sometimes. So the next thing we need to talk about here is limitations to CBT. Therapists may become so caught up in the need to follow protocol for evidence-based practice that they fail to address real-time changes occurring in the clients' lives. I feel like this is something that all of us as therapists can get sucked into. If we are so focused on what's going on right then, or what the evidence-based protocol behind CBT is in therapy, then we fail to realize that they have other things going on in their life, and maybe that's what they need to focus on in therapy, and not necessarily just the process of CBT. Sometimes the process overtakes our clients' real issues, or we forget that they have actual problems. We're so focused on the process and because of the evidence behind it, and that kind of thing. So that is something that I think as therapists we need to be mindful of when we're practicing cognitive behavior therapy. So some of the future directions of CBT, right now it's the most popular and the fastest growing form of therapy, as well as the most empirically researched of all the contemporary systems of counseling and psychotherapy available. And there's two reasons for this. One, its openness to incorporating other empirically supported therapeutic techniques. And two, its solid grounding in empirical research, especially controlled outcome evaluation. So there is a lot of evidence and empirically based research behind CBT that does make it so fast growing. So I think that's something that we're going to continue to see. Well, I think we'll also continue to see more therapeutic techniques being incorporated into CBT. We already have several, as we talked about earlier, but I feel like there's probably going to be more that can be incorporated into it in the future that will really enhance CBT to be the best thing for our clients. So when we look at a biblical, let's look at the biblical perspective. It emphasizes the primacy of agape love, which is talked about in 1 Corinthians 13. And it also emphasizes the need to develop a warm and empathetic and genuine relationship with the client. This is true. We tend to, as therapists, sometimes we tend to maybe detach ourselves, or we just get numb to the relationships that we have with our clients. And I think CBT does a good job of keeping us accountable for those relationships, because it keeps us on our toes and making our clients accountable for their thoughts, feelings, behaviors, actions. And something else is it emphasizes the Holy Spirit's ministry in bringing about inner healing, as well as cognitive, behavioral, and emotional change. We learn and we can teach our clients in a Christian setting to use prayer and affirmation of God's words and facilitating dependence on the Lord to produce deep and lasting personality change. Which in turn is really what CBT does. It teaches the client to have that long and lasting personality change. But if we are in a Christian setting and we have Christian clients that we can really talk to about the Christian aspect or the biblical aspect of CBT, I think it's important that we teach them to lean on the Lord for those things. So that's another really big thing in CBT that we can teach our clients. I wouldn't necessarily force that on someone that's not a Christian. That's something that, is client-based, and you would have to figure out if that's a good fit for your client or not.